welcome you today for our webinar on protein intake and the prevention of kidney disease. You know, this year's motto for the World Kidney Day on 10th March is Kidney Health for All. That also includes education initiatives. Today's webinar is important in our strive to reduce the knowledge gap in CKD. The general understanding of all public is that proteins are very good foods. It builds muscles, improves general health, and as a result, children, young adults, bodybuilders use a lot of protein in their diet and are given protein. Yet in certain medical conditions, proteins can be harmful to our body. So this seminar is for that topic. Let us hear about this topic now. Our speaker today, an expert, is Dr. Arvind Reddy. He's a consultant nephrologist at Care Hospital and has worked earlier in MNR Medical College and Preeti Urology and Kidney Hospital in Hyderabad. Among his special interests are hemodialysis and renal transplantation. Mohan Foundation welcomes you and appreciates your time you're giving to us to educate our people. Thank you so much, Doctor. All over to you now.
Yes, am I audible, Mahendra? Yeah. So, good evening, everyone. I'm Dr. Arvind Reddy, working as consultant nephrologist at Care Hospital, Gachibowli. So, today let us discuss something in relation with protein intake and kidneys. So, I feel this topic could be interesting because of late nowadays we are most of us, especially young adults are advocating weight loss protocols. As a part of that initiative, the calorie, carbohydrate and fatty carbohydrate. Yeah, am I audible?
Yeah.
Yes. So we are advocating high protein diet protocols of late as a part of weight loss protocols. So is really high protein diet good for us? And what group of patients are supposed to avoid this high protein diet? And is it good for general population? So before going to that, let us discuss something about kidneys. So coming to kidneys, there are two kidneys which are bean shaped, and each kidney contains around 8 to 10 lakhs of nephrons, which are the functional units of the kidney. So these are the working employees of the kidney. So the lesser is the number of nephrons, the lesser is the kidney function, and it will be depicted in the form of rise in creatinine. So we usually check kidney function in terms of creatinine, which is a biomarker of renal failure. So what is the normal creatinine levels in Indians nation group especially? So in Indians, the normal creatinine value should vary between 0.8 to 1 milligrams per deciliter. So creatinine value beyond 1.1 milligrams per deciliter in Indians is obviously considered to be high creatinine. So greater is the creatinine, less is the kidney function, and it implies that less number of nephrons are functioning. So say for example, as I told, each kidney contains around 8 lakhs nephrons. In total, two kidneys contains around 8 plus 8, 16 lakh nephrons. So greater is the creatinine, it implies that less number of nephrons are functioning. So as the creatinine increases, it implies the nephron number is decreasing, and it implies that kidney function is decreasing. So say for example, you take a 40-year-old male who has creatinine of around 1.2. We take the reference range between 0.8 to 1.3. Most of the laboratories take the reference range between 0.8 to 1.3. But is 1.3 normal for a 40-year-old Indian male? Definitely not. You take around creatinine of 1.2 for 40-year-old male. We calculate the filtration rate based on the age and the creatinine values. It comes to close to around 60. But the normal filtration value is between 90 to 120. So it implies that definitely this person of 40-year-old with creatinine of 1.2 is not having normal kidney function. It implies that he is having kidney disease. Say it could be either chronic kidney disease or acute. So a patient with 1.2 creatinine, young male with 1.2 creatinine will not have any symptoms. So he doesn't approach to doctor. His creatinine will be underseen, and whether this patient has to take high protein, low protein, or normal protein is the question. So any patient with creatinine beyond 1.1 for more than 3 months is considered to be having chronic kidney disease. So we will try to link protein intake with these patients with chronic kidney disease. So before that, what is the exact amount of protein required in general population or in chronic kidney disease population? So before that, we will subdivide the protein intake into different groups. Say high protein intake diet, high protein diet, normal protein diet, low protein diet, and very low protein diet. So if we are following high protein diet, so it includes a protein intake of more than 1.5 grams per kg per day. So anything beyond 1.5 grams per kg per day as per MDRD is taken as high protein diet. But so all the young adults who are advocating for keto diet or Atkins diet usually take around 2 to 2.5 grams per kg per day. So this is obviously high protein intake. So high protein intake, and especially these adults who are taking more than 1.5 grams usually advocate animal meat rather than plant source of protein. So animal protein versus plant protein. So these differences also to be addressed. So coming to normal protein intake, normal protein is around 0.8 to 1 grams per kg per day. So high protein is anything beyond 1.5 grams per kg per day. Normal protein is between 0.8 to 1 grams per kg per day. Low protein is between 0.6 to 0.8 grams per kg per day, and very low protein is below 0.6 grams per kg per day. Of course, it is easy to pronounce in terms of grams, but what exactly is low protein, and what exactly constitutes the low protein diet? So as I told, anyone who is following Atkins diet or keto diet, they depend a lot on animal source of protein, especially red meat. They usually consume a lot of red meat, at least 2 to 3 times a day. So that ultimately constitutes to more than 1.5 grams per kg per day. So normal protein, it can be divided into animal protein and plant-based protein. So animal protein usually contains red meat or any other alternative source of meat. Along with that, it contains plant sources of meat like legumes, jowar, bajra, and eggs. These all are general vegetable sources of proteins. It is rich in fruits and vegetables. So what constitutes low protein diet between 0.6 to 0.8 grams per kg per day? So these can be excluding animal meat. So normal protein diet, it could be either animal diet or plant diet, but it constitutes up to 0.8 to 1 gram per kg per day. Low protein diet usually avoids animal protein, and it's only exclusively plant-based diet. So plant-based diet without milk products and eggs, it constitutes to around 0.6 to 0.8 grams per kg per day. And another thing is very low protein diet. So very low protein diet is below 0.6 grams per kg per day. So in this, they don't take animal protein, no milk-based products and eggs, and also no vegetables, like no vegetables and no dal, no jawar, no chana as well. So broadly classifying this protein intake into high protein, normal protein, low protein, and very low protein. So very low protein do not contain animal protein, do not contain plant-based protein. Low protein exclusively avoids animal-based protein and takes only plant-based protein, excluding milk products. Normal protein can be animal protein, plant protein. It also includes milk dairy products as well, including eggs. And high protein, of course, it is exclusively made of animal-based protein. So why I'm discussing all these things is, in various stages of kidney disease and various types of kidney problems, we usually advocate to certain type of protein intake. Say, for example, as we are discussing protein and kidneys, regarding protein and kidneys, first of all, let me address what exactly protein does to kidney. So high protein or whatever might be the protein intake, if it is on the higher side, it will have impact on the kidneys by increasing its glomerular filtration pressure. So the filtration pressure on the kidneys will be increased. We call it as glomerular filtration pressure. And apart from that, it also has impact on progression of kidney disease by other means, like it will increase the oxidative stress, it will increase the body acid load, it will increase the phosphorus load, and the end products of protein metabolism, which are nothing but the nitrogenous waste products like indols, phenols, prenols, cresols. These things will have deleterious effects on the kidney. So eventually, whenever the protein percentage is increased, it will have some stress on the kidneys, eventually causing the progression of kidney disease, causing the progression of kidney disease to go rapidly. So what we advocate, say for example, any patient with one for more than 3 months duration or any structural kidney abnormalities for that matter, we usually advise them to take a low protein to normal protein. Say for example, a chronic kidney disease patient whose creatinine is beyond 1.1, KDIGO recommends protein intake between 0.6 to 0.8 grams per kg per day. So these group of patients to avoid animal meat.
So you're breaking up. I think we have lost him just now.
Yeah. Am I audible now?
Yeah, can you just repeat last 2-3 sentences that got lost?
Yes. Sure. Now is it okay, madam?
Yes.
Yeah. So coming to plant protein versus animal protein has more impact on the kidneys by increasing the glomerular pressure even more than in comparison to the plant-based proteins. And it will also alter the gut microbiota, gut biogenome, we call it. So eventually we advocate for plant protein rather than animal protein. So anybody with chronic kidney disease, we advise them to take protein intake between 0.6 to 0.8 grams per kg per day. So what diet is included in this group? As I told, it excludes animal protein and plus or minus dairy products and eggs. So if you are going for dairy products and eggs along with other forms of vegetable proteins, like as I told, dal or chena, if you are taking these plant-based foods along with dairy products, it constitutes roughly to around 0.8 grams per kg per day, avoiding animal protein. So if we want to go for even further low protein intake, which constitutes to between 0.6 to 0.8, so then it's better to avoid dairy products and rely more on plant-based proteins like dal, chena and all, and legumes, whatever fruits and vegetables can be taken, but excluding animal protein and also dairy products. So plant-based proteins plus dairy products, it constitutes to around 0.8. This is roughly calculated because we Indians, we usually rely on these type of foods. So have excluded these things to constitute around 0.62 or 0.8. So if you want to go for very low protein, avoid dairy products, avoid animal protein, strictly rely on plant-based protein. And if you want to go between normal or low protein diet, you better avoid only animal-based proteins. So any patients with chronic kidney disease, especially who are not proteinuria, can stick on to low protein diet or normal protein diet. Very low protein diet is usually avoided. I'll explain you later regarding the same. So when we are going for low protein diet, excluding animal proteins and also dairy products, better we add supplementation with keto analogs. Keto analogs are not unequal to keto diet. Don't get confused with keto analogs and keto diet. Keto analogs are nothing but they are essential amino acid substitutes which do not contain nitrogenous material. So these essential amino acids, they help in avoiding protein energy malnutrition when we are sticking on to low protein diet. So low protein diet, of course, proteins are the building blocks. When we stick on to low protein diet, take very low protein, we need protein for daily essential activities. For every biochemical reaction that happens in the body, proteins are essential. So in that case, when we are sticking on to low protein diet, better take supplementation with alpha ketonologues. As I told, these are the essential amino acid substitutes. They are available in capsule forms. They can be substituted with the help of low protein diet, which is to be consumed during food intake. So this is the case in with chronic kidney disease patients. Anybody with creatinine more than in anybody with problems like diabetic patients who have chronic kidney disease, and along with that they have protein loss, significant protein loss, nephrotic range proteinuria, nephrotic syndrome, wherein the protein loss is more than 3 to 4 grams per day. So in these cases, we usually advise them to be either on normal protein or low protein, but not on significantly lower protein. So somewhere beyond 0.6 grams per kg per day is allowed in these patients with CKD and chronic kidney disease and proteinuria. So these proteinuric patients, because on the top of chronic kidney disease, these proteinuric patients can become malnourished. So we should be very skeptic in advocating the food type of food, because very low protein can result in significant malnutrition. So especially chronic kidney disease with proteinuric patients, we advise them to take normal protein or low protein, just by avoiding animal-based protein and advocating to plant-based proteins. So this is in case of chronic kidney disease, and also chronic kidney disease with proteinuria, significant proteinuria, nephrotic range proteinuria. So what about the patients who are on maintenance hemodialysis? So these patients, patients who are on maintenance dialysis, these patients have their kidneys function lost completely. So they rely on dialysis support. So these patients will be on twice or thrice weekly hemodialysis. So in these patients, they are in a highly catabolic state, wherein each dialysis is associated with the loss of around 20 to 40 grams of protein with each session. So they will be in a highly catabolic state. Their muscles will be subjected to protein loss, and eventually they'll become cachexic. So we ask these dialysis patients to be taking high protein diet, which constitutes to around 1.2 grams per kg per day. So plant-based protein or even animal-based protein at times, but we usually ask them to take plant-based protein, because animal-based protein is associated with high phosphate load, especially in chronic maintenance dialysis patients. This phosphate load can result in chronic CKD, mineral bone disease. So, but these patients on dialysis are allowed to take high protein diet up to 1.2 grams per kg per day. So after we have dealt with CKD patients, we have dealt with CKD patients in nephrotic syndrome, and now on with the transplant patients. So what about the patients with single kidney? Single kidney patients will have normal creatinine, those who have normal creatinine, and those with CKD. Of course, even with single kidney, the patients with CKD are treated as patients with regular chronic kidney disease. And those with single kidney with normal kidney function, of course, these patients with single kidney and normal kidney function will have high burden of what you call compensatory hypertrophy. And these patients, as they have less number of glomeruli, the workload on this single kidney will definitely be higher. But so whether to give low protein diet or normal protein diet in these patients, there are no clear consensus guidelines, but there are certain observational studies which have stated that these patients, it is better to avoid high protein diet rather than stick on to normal protein or low protein diet. So some observational studies quote that these patients with single kidney, secondary to congenital absence, or it might be secondary to tumor followed by resection of the kidney, or any other cause might be. So the patients with single kidneys, better to avoid high protein diet and stick on to normal low protein and especially plant-based protein diet. So coming to the general population, so this is of the topic of concern as of now. So general population, especially as I told, most of them are sticking on the high protein diet. Is high protein diet good for general population with normal kidney function? So those anybody on high protein diet, which is nothing but a protein intake of more than 1.5 grams per kg per day. So there are no clear consensus guidelines in this scenario as well. But there are certain observational studies, especially conducted in Chinese and Singapore Singapore group of subjects, and also of late recently in 2020 in Iranian population, which has taken sample of more than 1,000 subjects. So they have shown that they have divided the group into two groups: those with normal protein and those with high protein, which is taken as 1.5 grams as a cutoff. So they have found that definitely high protein intake is associated with glomerular hyperfiltration. As I told, the glomerular pressure increases, with as a result of which there will be glomerular hyperfiltration and ultimately some protein loss and some stress on the kidney. They have been followed up for a short period of 6 months, but they could not find any statistical significant difference between high protein group and normal protein group. But these are to be followed for long term. There is a small study which has been followed up for 24 months period. They also could not find statistically significant difference, but definitely they believe that high protein diet is associated with increase in the filtration pressure in the kidney, and definitely the workload on the kidney is high when we advocate high protein diet. So on the whole, by and large, so coming to general population, we feel that anybody who is at high risk of chronic kidney disease, like those with diabetes, hypertension, solitary functioning kidney, or those with family history of diabetes, these group of subjects better avoid high protein diet and stick on to normal or low protein diet. And especially with these comorbidities and evidence of chronic kidney disease with in the form of proteinuria at least, better we advise them to take low to normal protein diet, avoiding animal protein. So this is it, and anything related, any queries can be answered now.
Thank you so much, Doctor, for this short and but elaborate information on protein and your kidney health. There are a few questions. Let me see if the chat, Anchal, you can add to the chat if you have. Okay. There's one question: any restriction for person who has cadaver kidney transplant for their protein intake?
Yes, so cadaver kidney transplant, this again belongs to solitary functioning kidney. So we generally advise no protein restriction, but rather it is always better to rely on to plant-based proteins, which constitutes to up to 0.8 to 1 grams per kg per day. Better avoid animal protein, and no need of protein restriction as long as your creatinine is stable and there is no protein loss in the urine.
Okay. So transplant patients can have a normal protein diet.
Exactly.
Yeah, okay. Thank you. There's one more question. At what stage does protein become a problem? At what stage of a kidney disease does protein intake become a problem?
Generally, ma'am, chronic kidney disease is being divided into 5 stages. Yeah. So stage 1 and 2 have a glomerular filtration rate of more than 60. So we usually advise protein restriction for anyone whose glomerular filtration rate is less than 60. So say for example, a 40-year-old with, as I told, with creatinine of 1.3, his filtration obviously will be below 60. Yeah. So as per MDRD, they have quoted that, say for example, a patient with filtration of 40 ml per minute, a patient with eGFR of 40 ml per minute, they have divided this patient, divided this GFR group patients into low protein and normal protein diet. So low protein group had a decrease in the progression of kidney disease. by terms of they had a better GFR of around 1 ml per kg per minute per year. So if we see this patient of 40 years old, patient with 40 ml GFR, and he is losing GFR of around 4 ml per minute per year. And if we could decrease it to from 4 to 3 ml per minute per year, we can save his kidney life by around 3 to 4 years. So this patient with 40 ml GFR with loss of 4 ml per year will end up in end-stage renal disease by around 8 years from that point.
Okay.
And he could decrease it from 4 ml per minute to 3 ml per minute, his kidney lasts for 11 years. So 3 years difference with a 1 ml decrease in GFR.
There has been long-term studies done.
Yes.
That is good to know. There's one more question, doctor. What if there is proteinuria? Then how much protein is required?
As I told, though any patient with proteinuria is not advised to go on with high protein intake or protein restriction. So protein restriction with proteinuria, obviously, it causes undernutrition and malnutrition. Malnutrition is very deleterious. So we usually allow them to take normal protein, but avoid animal-based protein, because it will further increase the glomerular filtration pressure, and obviously proteinuria is good.
Okay. There's one more question. Is there a relationship between protein and phosphorus? Because some patients are told not to have phosphorus-rich food also.
Yes. Yeah, there is relation between protein, especially animal protein. It is associated with the catabolites generally contain phosphorus content, phosphate content as well. Animal protein is associated with high phosphate load, and of course, phosphorus has got a direct relation with progression of kidney disease, and also it is known to have impact on the mineral bone CKD, MVD. So those with high phosphate load, eventually when they land up in dialysis or chronic kidney disease, they will have CKD, MVD in the as a part of long-term outcome. Yeah.
One more question. I have had a transplant in 2015, but I'm having a lot of hair loss. I'm vegetarian but love paneer. So how can I, stop this hair loss? Is it related to my protein intake?
It is not exactly related to protein intake. Probably it could be secondary to micronutrients and trace elements deficiency. So of course he can take paneer. Paneer is not an objection in his case, provided his creatinine is decently fine. But even then he can take paneer. Paneer is not an objection. Yeah.
After transplant, when can a recipient start normal protein consumption?
So he can actually, that's what, he can actually start normal protein intake straight away. Yeah. So straight away, but better avoid animal-based protein.
Animal-based. Okay. Many patients have this protein powders to get well, to recuperate. This Ensure and all for senior citizens. There is a lot of these. Are these recommended for transplant recipients also?
Transplant recipients, see, madam, we usually give protein powders for CKD patients and maintenance dialysis patients, especially because these maintenance dialysis patients, their appetite is decreased, their nutritional status will be poor, they will be highly catabolic, and they ultimately land up in muscle wasting. So we usually advise them to take high protein diet, and also we give protein powders with high content of protein in that. So this is because their intake is not good. But as far as the transplantation is concerned, transplant patients with normal kidney function, their metabolism will be good and their appetite also will be good. So they don't have to rely on additional protein supplementation rather than relying on a reliable source of nutritional based protein. Yeah.
So you are talking about catabolism. What is that? What is the meaning of catabolic?
Catabolic is a state of metabolism wherein the calorie intake, which is not in par with the calorie requirement. So these patients will be burning more calories rather than taking burning more calories than the input. So obviously they will be catabolic and they'll try to get energy from the muscle, stored muscle, stored fat, and
Okay.
So this is how the catabolic state will be, especially being seen in maintenance dialysis patients.
Oh. So they use their own muscles to get energy. That's what you're saying.
Exactly.
Oh.
Yes.
Sorry to ask basic questions, but better to get clarity.
Yes, madam. Yes.
So what are the tests for protein, for understanding that you have a protein problem? What are the tests? What test does a doctor recommend?
So protein loss, by and large, diabetes is the most common cause of kidney failure across the world, across the country, and wherever you, which place, wherever might be the place, diabetes is the most common cause, irrespective of geographical location. So diabetic patients are the most, diabetic patients develop kidney failure mostly by protein loss. Initially, it will start with protein loss. So all these diabetic patients, we usually recommend for diabetic patients type 1 or type 2 to undergo proteinuria check at least every 3 to 6 months. So this can be done by basic complete urine examination, and urine for microalbumin is something which will detect protein loss at the early stages. So every diabetic patients better get their urine for microalbumin check done at least 3 to 6 months.
Okay. Yeah, I think, Anchal, are there any more questions?
No, ma'am. All the questions have been wonderfully answered.
Thank you so much. Thank you, Anchal, for this. Thank you, Dr. Arvind, for spending time with us and answering our questions also and giving us a nice short understanding of protein and kidney health. I wish we will also invite you once again for another topics, and we'll continue with our series of education on kidney diseases. So thank you all, and I'll end this session. Thank you so much.
Thank you very much.
Thank you so much.